Alrighty, this is part 1 of the appendicular skeleton, chapter 7. We're still working on the skeleton, but now we've left the axial for the appendicular, and we're going to work on first the upper and then the lower extremities, beginning with the very first contact point, which is the excuse me, sternoclavicular joint right here. So this is essentially the only contact point between the upper extremity, which would include the bones of the shoulder and the arm or brachium and the antebrochium, forearm, and hand. This is the only point of contact with the axial skeleton. Should you put out your hand to break your fall, and the weight of your body falls upon that hand, then this joint right here is going to bear the weight of the body in that procedure. So oftentimes this bone right here is a very commonly broken bone, the clavicle. It's something that you see at the Tour de France or when somebody tumbles downstairs, is a broken clavicle. Okay, so the clavicle itself is represented here. This is the top. It's very smooth, and you can feel your own clavicle. This would be the sternal, the blunt side here is the sternal side. Out here is the shoulder side. And you can feel how this actually almost acts like a little roof over the top of your humeral bone. Over here, you can see how it sort of sticks out this way. And then it joins up with the acromial process of the scapula, and the two of them act together like a little roof over the top of your head of the humerus right there. Okay, so smooth on top, roughened underneath. There is a little bit of musculature that I won't be naming for you, so you can dig for it at some point or another in your favorite Alice. But at any rate, so that's something to bear in mind. Here on the sternal angle, we begin with convexity and then go to concavity, right? And so that's how you know this is a right side and not a left side. If it was concave this way, then you'd have to flip it around, okay? And so sometimes that's the test that people give. I'm not really into that so much, but figuring out left from right is probably a good idea. Okay, so the other thing is that it fits right over the top of the first rib. So when you're using your finger right here to feel for the first rib, actually the first rib is not easy to find. If you put your finger just to the right here of the sternum and place it on the clavicle, and then try to sort of work your finger straight down on your own clavicle, you do find that there's something stopping your finger from going forward. You bring it a little bit further down, and there's a space. You bring it a little further down, and then you get this rounded feeling bone right here, which is the second rib. You bring it a little further down from that rounded feeling unit right there, and then you're in the second interspace, and you're ready to listen to a heart sound. Okay, so there's a couple ways of getting to the second rib. The idea here is that you could use the sternal angle to do that, and then you're at the second rib, then you go below and you listen. Okay, so over here is our clavicle, comes out this way, and we're going to then join up with the there we go, the scapula. And here's our scapula from the posterior view, which is the way you normally look at it, to the anterior view, which is up against the ribs. Okay, it does not articulate with ribs or actually any part of the axial skeleton, but it does have 16 muscles that we're going to be learning, some of which originate on this bone, some of which insert onto this bone. And if you learn all of those 16 muscles, then you'll have a good clue as to why this bone is so substantially stable in its location despite the lack of a joint. Okay, as we look from the outside posterior view here, you'll see that we have our acromion process up here. That's the shoulder. We have a spine that comes down. Also going forward, which is harder to see except from the other view, we have our coronoid process right there. I'm sorry, coracoid process. Here it is again. This is the acromion. This is our coracoid process, not to be confused with coronoid. Coronoid rhymes with paranoid, and it's in your head. It's part of the mandible, it's the coronoid. So this is the coracoid process. Over here we have the surface area to accept the head of the humerus. It's called the glenoid cavity, or fossa. That's over here as well. What's above the spine here is the supraspinous fossa. It's also going to be the name of the muscle that fits right there. Infraspinous fossa is right here, and it's also the name of the muscle that fits there. And then we have our lateral border, and there's some muscles coming off of this. We have our medial border. There's a lot of muscles attached here, okay, some of which are inserting. Okay, so then we have this quizzical looking unit right here. There is a muscle that inserts right here that comes up this way called levator, which you'll become familiar with because I'll bring that to your attention and you can work on it on yourself. You can reach your own and see how that feels to you. Okay, then we have this view right here, and actually this is sort of like a, I think of it sometimes as like the, how shall I say, the part of the teapot that sort of flips up, you know, that little unit that whistles. It's got sort of a little rocker quality to it. And so at any rate, it helps us apply movement. It's a hard sort of fastener feature on the back of our shoulder, and it brings us, how shall I say, certain types of leverage in mechanical movements. And we'll get into that when we get to joints and muscles. Okay, then we get to our humerus, and this is the bone of the brachium, or the arm. This is the anterior view. The anterior view always has the head slightly medially into the posterior, and we have these two tubercles here. We have the greater and the lesser tubercle. We have the intertubercular groove. This is where long head of biceps tendon fits and slides. Okay, so this is most definitely the front aspect here, the anterior view. This is the posterior view. Okay, what you'll notice is that there is a groove that comes around. So coming from the posterior and going down and then around this way, so down and around this way in the groove is a large nerve, and also an artery is going to be passing along that way as well. The radial nerve is fitting right there, so we have the groove for that. We have the deltoid tuberosity, so the deltoid bone, rather muscle, comes down and inserts right here so that we can abduct the arm away from the body, sort of pull the arm out sideways from the shoulder. Okay, then we get to the distal end down here, and we get all of these special features, the medial epicondyle, the lateral epicondyle. These are condylar processes right here, although they're actually named specifically. This is called the capitulum, and this one is called the trochlea. Okay, and you'll see how the bones fit together when we take a look at the ulna and the radius, which comes next. Okay, but I want to just bring to your attention especially that if we turn this around and we have the medial epicondyle right here, what you will notice is that there's a little groove back here, and you can feel it in your own medial epicondyle. If you put your finger here on the medial side of your elbow, you'll feel that something does stick out, and if you go underneath that thing, you bend your elbow, put your finger underneath, you'll find a depression right there. And be careful how much you push into it, because there's a bare nerve right there called the ulnar nerve, and we call it our funny bone. And so we can feel that right there. Okay, more in the next episode.